It's become really important for us to integrate oral health into primary care because this year alone, 186 million people will not visit their dentist. So this sort of thrusts it upon the primary care doctor. What we're seeing is that there's a lot of interaction between the mouth and the body. For example, if someone has really bad gum disease like periodontitis, their diabetes gets worse, their heart disease gets worse, even rheumatoid arthritis. And so the Institute of Medicine has put out papers to doctors to say, this is your role. And the latest one is in fact directed towards primary care doctors. When we think about oral health, we have to back up to prenatal patients and children. Moms can pass the bacteria on to children, so if we can catch this during prenatal care, that's really important. But then when a child is young, we want to try to get good habits established early and just try to keep the bacterial load down in the mouth. How do you do that? You get kids brushing their teeth early, you get them having a healthy diet, and you get them to the dentist so they can have regular checkups. By addressing this with children, first of all, we prevent cavities, which can lead to local infections and even infections that spread to the brain and to the airway, and we've even seen children die in hospital with that. But it also sets a lifelong approach to taking care of the mouth and therefore avoiding that downstream diabetes worsening, heart disease worsening, all because of the mouth. At UMass, the way we're taking this on is that first of all, we're starting with students, so the nursing students and medical students here get a curriculum in how to examine the mouth, how to talk to patients about oral health, and then how to refer to the dentist. In the community, we're working on a number of projects. For example, through the DentaQuest Foundation, I'm going into pediatric offices, family medicine offices, and training doctors and nurses how to talk to patients and parents about oral health, how to apply fluoride varnish, and again, how to make the referral. For example, we're doing that over at Plumley Village, at Hanneman Family Health. Another project that we're working on here at UMass is how to keep patients out of the emergency room. There's not always a dentist in the emergency room, so we want to get patients, if they do show up, directly into dental care, and so we're starting to bridge that gap by direct referrals. This is a really exciting time. First of all, we have the Affordable Care Act, which is expanding insurance for everyone. And in Massachusetts, if you have Mass Health or Medicaid, for example, children and adults get dental benefits. At the same time, there are projects going on around the country, for example, in federally qualified health centers, getting medical and dental to work together, trying to bridge the electronic health records and get HIV patients, prenatal patients, diabetes patients going from one side of the building to the other side of the building. The Affordable Care Act now says any level A or level B recommendation from the U.S. Preventive Service Task Force has to be covered, and fluoride varnish is one of those services. So every child in America now up to age 6 can get access to fluoride varnish through their doctor.